If you're having trouble deciding between two different hearing aids, then you need to turn yourself into a science project. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 276, and today I want to talk to you guys about what you should do if you're not sure which hearing aids are actually right for you. But before I get into it, do me a huge favor, click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. Okay, so what is prompting the topic of today's vlog? Well, I've had a number of patients over the years where after I've gone through a comprehensive 2-hour consultation with them to try to identify exactly what their wants and needs are, we still come up to a point where we're not 100% sure which hearing aid is perfect for them. Now, I will say 99.8% of the time, I'm able to, if I spend enough time and I do enough diagnostic testing, able to figure out exactly which hearing aid I believe to be the best hearing aid for a patient of mine. But every once in a while, there's certain variables that we just cannot predict, and I just had one of these cases a couple of weeks ago. So this individual had sustained a sudden sensorineural hearing loss in one of his ears. And basically this took away almost all of the hearing inside of that ear, while his opposite ear was completely fine. So typically when this happens and someone has no usable hearing in one of their ears, they really have a couple of options. They could go with a cochlear implant, they could do a bone-anchored hearing aid to send vibration and sound through their skull into their better hearing ear so they can hear someone on their bad side, or they can use something called CROS, where you have a hearing aid in the good ear, you have a CROS transmitter on the bad ear, and then you wirelessly send that sound from the bad side over to the good side so they can hear someone that's talking to them on their bad side. Usually through discussion, in fact in this particular case through discussion, we determined that a bone-anchored hearing aid would not meet the needs of this individual based on what they were looking for, and that they were not ready yet to go in for a cochlear implant evaluation to get a cochlear implant on their now deaf ear. So it really came up to the discussion of, okay, should we be doing CROS to send sound from the bad side to the good side? But here's the thing. This individual still had some level of speech understanding in their bad ear, and they still like the idea of being able to hear something in the bad ear, even if the quality of that sound is really bad. So I can't remember off the top of my head exactly what his word recognition scores were, but let's just say it's 30%. What that essentially means is that even if I were to put a hearing aid in their bad ear and amplify sound, they still would only be able to understand 30% of what they're hearing. Typically, that's not enough to get good speech intelligibility. So oftentimes, a lot of hearing care professionals will just say, you know what, we're just gonna route the sound into your better ear, let your better ear do all the work. But in this particular case, we were not sure whether or not this individual would get enough perceived benefit of stimulating the hearing in his bad side in order to essentially justify going with what we call BiCROS treatment, where we can stimulate the hearing in the bad side and route it over to the better hearing ear. So what do? Well, essentially, we end up doing a research project. We do an N of 1 research study on an individual patient. So typically our best practice fitting sequence, which we call our Applied 360 fit process, it is 4 visits inside of a 45-day window, and we use that time to optimize the performance of the hearing aids that we initially recommend at their Applied 360 Discover consultation appointment. But what happens if we're not exactly sure which hearing aid we want to go with? And in this particular case, we're trying to decide, should we be doing an AMP CROS treatment or a CROS treatment? And if we just commit straight to one and ultimately the other option would be best for this individual, we essentially are in a place where we would never have known if he would do better with the opposite treatment. So what do? Well, we basically split this Applied 360 fit process into 2 different fittings. So essentially we'll start off with one fitting. So basically fitting him with AMP CROS treatment, where we have 2 hearing aids and we're amplifying sound in the bad ear and we're routing it over to the better hearing ear. We do that for several weeks, and then we actually switch the treatment to where we take away the hearing aid out of the bad ear, we put a transmitter on the bad ear, and we route all of the sound over to the better hearing ear. And then once we're done, we essentially do validation outcome measures, and oftentimes a patient will know right off the bat, oh my gosh, this is the best treatment option for me with either the first thing that we attempt or the second thing that we attempt. But just in case it's very close, we do a validation outcome assessment so we can get their subjective performance improvement with either one of the treatments, and then whichever one gave them the best subjective outcome, that is the one that we ultimately go with into the future. Now, does this strategy of turning you into an N of 1 research study work for more things than determining whether BiCROS, AMP CROS, or CROS is most appropriate for you? Well, no. We can do this with pretty much everything. So the other typical thing that we see is that someone is up in the air as to whether or not a particular hearing aid or feature is appropriate for them. So we will essentially turn them into a research study as well, where we have them use a pair of hearing aids that have the particular features that we think would be appropriate for them, and then we switch them to a different hearing aid that has a different feature or that approaches a feature from a different angle, and they will go through the same type of assessment where they can subjectively identify if one option is better than the other option. The other thing that I'll say here is that there's a lot of debate in the hearing care world of whether or not going with premium level hearing aid technology is justifiable compared to mid-level or entry-level technology hearing aids. And so what you can do with this as well is that you can have your hearing care professional with devices that they have out there nowadays that can be modified and taken from a top tier device down to a low tier device just by adjusting it in the programming software. You can have someone blindly, or you can blindly wear a pair of hearing aids set at one technology level that you're unaware of, and go back in a couple of weeks and have your hearing care professional augment it to where it's on a different technology level. And then at the end of it, you can do a blind comparison of the performance from the first technology level that you attempted to the second technology level that you attempted. I actually ran a 4-person case study in my clinic. Geez, how many years ago has this been? Maybe 5 years ago. I think I'll try to link that video if I can find it down in the description for you. But this is essentially how I determine whether or not I'd be recommending entry-level technology or basic-level technology or premium-level technology. If you want to find out the results of that study, I do recommend that you go watch that video. But at the end of the day, an individual who's getting their hearing loss treated, they have to be comfortable with whatever treatment option you end up recommending. And if there is any question as to whether one hearing aid brand or one hearing aid feature or one treatment setup is more appropriate than another one, then you should probably turn yourself into a research project and figure that out. Just don't be surprised if your hearing care professional charges you to put you through a research study, because there's actually a lot of work. It's actually double the work when you think about it, because they're doing a complete new fitting on one treatment and a complete new fitting on another treatment inside of a treatment window. So it is a lot of work that they have to do, and they have to be really efficient with evaluating your performance and optimizing the treatment that they're fitting you with at any point in this process. So just bear with them. Don't be surprised if they extend the fitting sequence to get a really good test on each one of the 2 options that they're fitting you with. Now, here's the other thing. If inside of these 2 options that you go with, you're like, would a third option be better? Or would a 4th option, 5th option, 6th option? Here's the thing. Most hearing care professionals have been doing this for long enough to where they know with a high level of confidence that the top 2 options that they would have recommended for you are likely going to be the best options for you. You start testing 4, 5, 6, 7 different options, you're basically just going to get worse and worse and worse performance with either of them, because if the 7th option or the 5th option that they're testing on you would have been a better option for you, they would have recommended that in your top 2. So I wouldn't recommend that you do this like over and over and over again with every hearing aid on the planet. I think my vlog 2 weeks ago kind of explained that, where I had an individual go in and try like 5 pairs of different hearing aids from a big box store, and she didn't perform well with any of them. Really, if you're not performing well with the top 2 recommendations from the hearing care professional, chances are they just do not have either the technology or the expertise level in order to ideally treat you with hearing aids. So take that for what it is. But let me know, have you ever been debating 2 different technology levels or 2 different types of hearing aids or 2 different strategies when it comes to being fit with hearing aids, and you just can't decide which one to go with? Have you ever turned it into, or had your hearing care professional turn it into a research project, making you an N of 1? Let me know down in the comment section. I'm really interested to hear what you have to say.